This is Dr. James with Helpmommy.com, and today we're going to talk about some of the odd things that happen with teething. So the first thing is teething usually happens 2 months to 18 months. About half of the kids will have one by 6 months. At 4 months, every kid pretty much looks like they're teething. That's because developmentally, it's normal for them to drool and to chew on things. They just start producing more drool, don't know what to do with it, it just comes out. And chewing on things is how they determine texture and shape. So how do you tell the difference between a kid that's drooling and chewing on stuff and normal versus the one that's drooling and chewing and actually teething? Usually runny nose. Your normal symptoms of teething are runny nose, chewing on stuff, drooling, sometimes some fussiness. But also you can sometimes see some cough. This cough's different than you normally see with a cold. It's going to be kind of a choking sounding cough where they'll cough 2 or 3 times, sound like they're choking, and then not cough again for an hour or two. The order that teeth come in is variable. If you're going to bet in Vegas, you're going to usually bet that the 2 front bottom ones come in first, then the 4 top. Then they'll come back and get the 2 other front bottoms, skip back and get the molars, and then the canines come in last. That's just what most of them do, but they can come in any order. I've seen them get their canines first, their molars first. I had one that looked like a toothless vampire. It's all fine, doesn't matter. It's just what's the most common versus less common. Other things that are kind of weird is that sometimes you can get this little white bump on the gum. This is what we call a gum cyst or a tooth cyst or an Epstein pearl. They're little protein-filled cysts. They don't affect the tooth at all. Once the tooth comes in, they go away. Other things that can happen is as the tooth is cutting through, it cuts into a blood vessel and it causes a big purple swelling that almost looks like a blood blister. This is, again, fine. It happens. Not very common, but it can happen. And when it happens, it's not anything to worry about. It goes away on its own. Rarely you can have teeth that come through that are yellow and pitted already. These kids are going to have a much higher chance of causing dental cavities and caries. And so if you see these, you want to get in as soon as possible so that they can start applying fluoride varnish to try and prevent cavities as much as possible. Another weird thing that can happen is every once in a while you'll have a natal tooth, which is a baby that's born with a tooth or 2. These teeth can sometimes be a 3rd set and they just roll out. They don't really have a root system. But sometimes they're actually their first set of teeth. And so we try and care for these, but a lot of times they're not very healthy teeth. They're discolored. A lot of times we have problems with these. If we see these, we try and get them assessed by the dentist as fast as possible to see what we need to do, if anything, to try and help them. Those are the most common things that happen with teeth. That are odd. But again, if you see a tooth that bothers you, that looks funny, definitely check with your doctor. They will be able to determine whether we need to see a dentist as soon as possible. Hope that helps. You guys have a great day.